Okay, let's get into this. That feeling, when your thoughts just won't stop, like a mental hamster wheel just spinning and spinning, leaving you feeling completely drained.
Mm-hmm. Overwhelmed.
Exactly. It's something most people can relate to, I think, that sense of just thinking too much.
Right.
And it turns out in Zimbabwe, there's actually a specific term for it, kufungisa.
Yes.
And it seems this term, it's often linked quite closely sometimes to what we might understand as depression. It's really interesting, isn't it? That specific cultural framing.
It is. And while thinking too much is the literal translation, Kukungiza often carries, well, a heavier weight. It implies deep sadness, constant worry, feeling really burdened by life's
It
problems.
was more than just worry.
Definitely. It's understanding that kind of deep emotional distress within their specific cultural context. And, recognizing that term is often the first real step to addressing it effectively within the community.
And this isn't just a small issue, is it? We're talking about a global scale problem here.
Oh, absolutely. The World Health Organization, they estimate over 300 million people worldwide suffer from depression. It's staggering.
And the consequences are devastating.
They are. The statistics are just stark. Every 40 seconds, someone somewhere dies by suicide.
Wow, every 40 seconds.
And what's really concerning is that a huge number of these deaths happen in low and middle income countries. Suicide is actually a leading cause of death for young people, those aged 15 to 29.
That's heartbreaking. And it highlights this huge unmet need, doesn't it? Because depression is treatable.
It is. But the access to care, it's just severely limited in so many places.
Yeah, I read about the situation in many countries, the ratio of psychiatrists. It's something like one psychiatrist for every 1.5 million people.
That's right. In many low and middle income countries, that's the reality. It paints a really bleak picture of the mental health care gap.
And this brings us to a particular story, doesn't it? A psychiatrist in Zimbabwe.
Yes, a very powerful personal story. This psychiatrist, he was one of only about 12 in the entire country, for a population of 14 million people.
Just 12? Unbelievable.
And he tells this story about a patient, Erica. She was 26. He'd treated her before. She ended up in the ER after an overdose and needed further psychiatric assessment.
Okay.
The plan was for her to travel to see him again, but she died by suicide. Her family couldn't afford the bus fare.
How much was the fare?
$15.
$15. Wow, that just, it hits hard. $15 standing between someone and life-saving care.
Exactly. You can only imagine the impact that had on him. The soul-searching.
It really throws the traditional model into sharp relief, doesn't it? The idea of people having to travel, often long distances, to a central clinic or hospital, it just doesn't work when resources are so scarce, and even small costs are huge barriers.
It forces you to ask fundamental questions. How do you reach people when they literally cannot reach you?
So, faced with this tragedy, what did he do? Where did he look for answers?
Well, this is where it gets really innovative. He had this realization, this powerful insight, right there, in the communities where professional help was almost non-existent.
Yes.
There was this incredible, untapped resource, grandmothers.
Grandmothers. Okay, that's unexpected. How did he make that leap? What was the thinking there?
Well, think about it. In many communities, grandmothers are already these pillars, right? They hold respect, they offer wisdom, support. They're often the ones people naturally turn to, the listening ear.
That's true. They often have that inherent trust.
Precisely. So the idea was, what if we could train these respected women in evidence-based talk therapy? Give them the core skills.
What kind of skills are we talking about?
Primarily techniques rooted in cognitive behavioral therapy, or CBT. Things like, active listening, really hearing someone. Empathy, obviously, but also practical things like behavior activation.
Behavior activation, what does that involve?
It's about helping people gently re-engage with positive or routine activities they might have stopped doing because of their depression. Simple things. Maybe encourage someone who's isolated to just call one friend. Or help them plan a basic daily activity scheduling to bring back some structure. Small, manageable steps.
Okay, so practical, grounded techniques. And how would they be supported? They weren't just sent out on their own, were they?
No, absolutely not. A key part was using mobile phone technology for communication, for guidance, for supervision. The program actually started back in 2006, training that first group of grandmothers.
And using CBT principles makes sense, focusing on those practical changes in thinking and behavior.
Exactly. It's about empowering people with tools they can use right there in their challenging circumstances.
So it's not replacing psychiatrists, but building this vital first layer of support right within the community fabric. Was there pushback? Was the established systems skeptical about, non-professionals doing therapy?
There were definitely questions initially, as you'd expect with any new approach. But the sheer scale of the need for any mental health support, combined with the deep respect people already had for the grandmothers, that really helped get it off the ground.
And the impact. What has this program, the Friendship Bench, is that what it's called?
Yes, the Friendship Bench. The impact has been, well, truly remarkable. We're talking hundreds of grandmothers now working across more than 70 communities in Zimbabwe.
Hundreds. Wow. And how many people are they reaching?
In the last year alone, they provided treatment and support to over 30,000 people.
30,000 people. That's incredible. People who likely wouldn't have received any mental health support otherwise.
Precisely.
But the big question, I guess, is, does it work? Beyond feeling good, is there solid evidence?
There is, and it's quite groundbreaking.
Yeah.
Research on the Friendship Bench was published in a major medical journal, JAMA, the Journal of the American Medical Association.
Okay, that's significant. What did the study find?
The findings were really striking. They followed people for 6 months after they received treatment from a grandmother. And even after 6 months, these individuals were still showing significant improvement. Their depression symptoms were reduced, and importantly, suicidal thinking had decreased.
That's fantastic. Sustained improvement.
But here's the part that really raised eyebrows: the clinical trial. It actually found that in this specific context, the grandmothers were more effective at treating depression than doctors were.
Wait, really? More effective than doctors?
Yes. Now, it's specific to this context, this type of community-based intervention for common mental disorders. But yeah, even the psychiatrist involved admitted he was initially a bit put out by that finding.
I can imagine. But what a testament to the approach. Can you paint a picture for us? Like, how does a session actually happen?
Yeah, let's make it concrete. Picture Farai. She's 24, mother of 2. It's a warm August morning in Harare, and she's walking towards a simple park bench. She looks completely dejected, just exhausted, and she's holding an envelope from the local clinic. Sitting on that bench is grandmother Jack. She's 82, a well-known figure in the area. Farai hands her the envelope. Grandmother Jack reads it, and there's this moment of quiet understanding. Then she looks right at Farai and says, very gently, "I'm here for you. Would you like to share your story with me?"
That simple invitation, you can feel the significance. What was Farai going through?
Farai started talking, tears filling her eyes. She shared that she was HIV positive, had been for 4 years. Her husband had abandoned her a year ago. She was unemployed, really struggling to care for her 2 young kids.
Just an immense burden.
Totally overwhelming. And she admitted that for the past 3 weeks, she'd been having these recurring thoughts of suicide, even thinking about taking her children with her. The clinic nurse had recognized her distress and referred her to grandmother Jack.
Oh, wow. And how long did they talk?
That first conversation lasted maybe 30 minutes.
And grandmother Jack's response to hearing all that pain?
Just deep empathy. She listened intently. At one point, she moved a bit closer, put a hand gently on Farai, and said something like, "Farai, it's okay to cry. You've carried so much. Would you like to share more?"
Just validating her pain.
Exactly. And then, towards the end of that first talk, grandmother Jack used that term we discussed. She said, "Farai, it seems to me that you have all the symptoms of kufunjisa."
Kufunjisa. Thinking too much. How did Farai react to hearing that word used for her experience?
It was apparently quite powerful.
Hmm.
Because it's a local, culturally understood term, it seemed to resonate deeply. It wasn't a foreign clinical label. It was something that named her suffering in a way that made sense to her. It helped her open up even more.
That cultural relevance is key, isn't it?
Absolutely critical. Farai ended up having 6 sessions in total with grandmother Jack, right there on that park bench.
6 sessions. And what happened to Farai? Did things improve for her?
It's a really positive outcome. Today, Farai has found employment, and her children, they're both in school. It's a real illustration of how this support can help someone find their footing again.
That's wonderful news. A real turnaround. And grandmother Jack. She sounds like quite a force.
She really was a central figure. Sadly, we learned she passed away one morning back in February. She was actually getting ready to see her 257th client that day.
257 people she helped directly. What an incredible legacy.
It truly is. And her legacy lives on through this growing network of grandmothers she helped inspire. They're continuing that vital work.
It's amazing how it started and how it's grown. And it's not just contained within Zimbabwe anymore, is it? This idea is spreading.
That's right. People are seeing the potential for this model globally. And think about the demographics globally. We already have over 600 million people aged 65 or older.
Wow, that many.
And that number is projected to hit 1.5 billion by 2050.
So a huge potential pool of wisdom and experience.
Exactly. The vision now is building this global network. Trained grandmothers, supported digitally, working in cities all over the world, helping to close that massive treatment gap for mental health.
Where else has it started?
It's already spread to places like Malawi, Zanzibar,
Uh-huh.
and even New York City. They're adapting the model there.
From Harare to New York City, that's quite a journey for an idea born on a park bench.
It really is.
So this whole deep dive, it really uncovers this deceptively simple yet profoundly powerful solution to a huge global health crisis.
It really does. It boils down to some fundamental human elements, doesn't it? Listening,
Yeah.
empathy, understanding distress within its cultural context.
The power of human connection, really.
Absolutely. And the incredible potential that's often overlooked right there within our own communities.
It definitely leaves you thinking. Considering all the wisdom and life experience held within communities everywhere, what other complex problems might have solutions hiding in plain sight if we just shifted our perspective a bit? If we looked for resources beyond the usual places and empowered the people already there, it's something to really mull over, the potential of connection and maybe less traditional paths to well-being. Definitely food for thought long after our deep dive today.